Hello, welcome to my channel. I'm Zainab Khatun. I'm a psychologist. So today I am going to tell about anxiety. So what is anxiety? Anxiety is like a feeling of worry or unease that make you feel nervous or scared. Okay, so it's a bit like when you are about to give a presentation in front of your class, or when you are waiting for your exam results. Your heart might race, you might feel sweaty, and your mind might rest with all sorts of thoughts. Okay, so everyone experience anxiety sometime, but for some people it can become a trigger problem. Okay, so they might worry excessively about things that most people would not, or their anxiety might interfere with the day life. So this is called anxiety disorder. Okay, so how anxiety differ from normal stress or worry? So what is stress? Stress is a body's way of responding to a specific challenge or demand. It's a normal reaction to situation like a big exam, a tight deadline, or a or a disagreement with a friend. It usually goes away once the situation is resolved. Okay, so what is worrying? Worrying is like thinking about something that might go wrong in the future. It's a common human experience, and a little bit of worry can even be helpful, as it can motivate us to prepare for challenges. Right? There are many types of anxiety. So now I'm going discussing about generalized anxiety disorder. Okay, so what is GAD? Okay, so this disorder is characterized by excessive worry and anxiety about a variety of things like work, finance, and health. Okay, so people with GAD often find difficult to control their worry, and it can interfere with their daily life. Right. So next is panic disorder. Okay, so what is panic disorder? This disorder is characterized by recurrent panic attack, which are sudden episodes of intense fear or discomfort that reach a peak within minutes. Okay, so during panic attack, a person may experience physical symptoms like chest pain, heart palpitation, shortness of breath, and sweating. So these are called panic disorder. Okay. So next is social anxiety disorder, or you can say social phobia. Okay, so what is social anxiety disorder or social phobia? So this disorder is characterized by an intense fear of social situation like speaking in public, eating in front of others, or meeting new people. Okay, people with social anxiety disorder often avoid social situation, right? So last one is specific phobia. So what is specific phobia? So this disorder is characterized by an intense fear of specific objects or situation like spider, height, and enclosed spaces. Okay, so people with specific phobia often go to great lengths to avoid their feared object or situation. So these are all types of anxiety disorder. Okay. Anxiety can cause a wide range of physical emotional symptoms. So physical symptoms of anxiety are, that is muscle tension. So this can cause headache, neck pain, back pain. Next is fatigue. Okay, so this can make it difficult to concentrate and perform daily tasks. So next is restlessness. So this can make it difficult to sit still or relax. Okay, so next is irritability. So this can make it difficult to get along with others. Okay, so next is sleep problem. So sleep problem is, this can include difficulty falling asleep. Okay, so next is gastrointestinal problem. So this can include diarrhea, constipation, and nausea. Okay, so increased heart rate or blood pressure. So this can cause chest pain, palpitation. So next is sweating, tremors, and dry mouth. So these are all our physical symptoms of anxiety. So next is emotional symptoms of anxiety. So these are excessive worry about a variety of things like work, finance, and health. Okay. So next is fear. Fear about some specific things like heights, spiders, enclosed spaces, some social situation. Next is panic attack, avoidance, difficulty concentrating, feeling overwhelmed, feeling restless, sleep problem, irritability. These are all physical symptoms of anxiety, right? So here are some common causes of anxiety. Anxiety can be caused by an imbalance of chemicals in the brain like serotonin, norepinephrine. So this chemical help regulate mood, sleep and other important functions. Okay, if you have a family history of anxiety, you may be more likely to develop the disorder yourself. If you have a stressful life, even like job loss, divorce, or the death of a loved one, it can trigger anxiety. Okay, alcohol and drug use can increase anxiety symptoms. Certain medical conditions like thyroid problem, heart disease can cause anxiety symptoms. Okay, so these are all the causes of anxiety disorders, right? So that's all for today.